And therefore, nobody needs to change. They only need to use a little bit of IT in the way they do things. And that, I think, is when we reshift the way we position this, that we will have more doctors in the audience, we will have more evangelistic nurses saying, yes, I love my iPad and I'm going around the nursing station and I don't want to write on paper and I will make data entries. But also the good thing you heard, and I welcome that era, is when the secretaries are saying we will get together and do standards, we will create telemedicine pods and drop them into villages, we will connect all of you on a neural network. It's the era we all need to collectively welcome. And so with this, I think I would like to warmly welcome each one of you. Thank everyone. Many of our speakers have flown from across the world to be here with us to share their knowledge. Mark Provost from Intermountain said yesterday something very significant. He said, I believe it is a crime if healthcare continues to be a series of individual interactions between the patient and the doctor. When can we take that knowledge, encapsulate it, share it in a manner which is easily understandable so we make a fresh MBBS as capable as a doctor who's worked 25 years in a particular specialty, because we're transmitting that knowledge by analysis or evidence-based medicine into care protocols. There are 100 incidents like this that we can quote and state. Professor J. Mohan from Malaysia and Singapore has transformed e-learning and education and been among the early ones to create the paperless hospital. We have our professor from Harvard, from Georgia, from UK, from Canada, from Sweden. I want to thank each and every one of you and our national speakers who have really gone this uphill task of working in this space which 5-10 years ago nobody really thought would have any kind of base. And finally, I especially welcome Lee Shapiro, not just the president of the world's largest EMR company, but an outstanding human being. So Chairman, welcome to you, but thank you so much for your support in helping Apollo be one of the forerunners in IT, and welcome to each and every one of you. Let's have a wonderful 2 days of deliberation, but let's also remember that every minute that we only deliberate and not act, somebody is being denied of healthcare, whether it's in rural India or in urban India. So let's quickly get together and act. Welcome and thank you and namaste.
Good afternoon, everybody. I have immense pleasure to oversee the company's strategies, corporate marketing, government relations, mergers and acquisitions, internal operations, basically entirely. He also serves as the executive sponsor for Allscripts and various key strategic relationships. Lee serves on various boards of various organizations. Since becoming the president of Allscripts in 2001, Lee has led a team that develops the network of alliances that are and will continue to be critical to the company's success, with the goal of improving solutions, expanding offerings, enhancing market presence, and broadening opportunities. Well, this is the serious side of it. Now, the nicer side of Lee. He's a great philanthropist. He spends a lot of time and also initiates a lot of us to spend time for the society and give it back to the society whatever best we can. As you can see, the way he's structured, he's a great runner. He's a marathon champion. Probably he ran before he could walk. Well, I'm truly privileged, and honestly, it's an invigorating experience to invite Lee to this conference, and may I welcome Lee to deliver the address. Lee, the stage is yours.
Thank you, Venkat. Thank you, Sangeeta and Chairman Reddy. Mujhe yaha perbolne ka moka dene ke liye bahut dhanyavad. Aapka amantron to mere liye suman hehi, lekin aapke swagat or Khatirdari se me orbi samanit mesus kurtahu. So I'm hoping what I said is, thank you for the opportunity to be here with you today. I'm so honored to be invited by Sangeeta, and even more honored by the warmth and courtesies extended to me since I've arrived. A special thank you again to Apollo for putting on this conference. Certainly some great work by Sangeeta in terms of helping for the past 3 years bring an important organization together. Also, since I'm standing between you and lunch, I will try to make my remarks brief this morning. Very quickly, just to introduce you to Allscripts, we are a publicly traded company in the U.S. with over $1 billion in revenue and 7,000 global employees. That includes close to 2,000 here in India, spread across 3 campuses. Our goal is to build a connected community of health, one in which providers across entire communities have the information they need when they need it to deliver coordinated, effective patient care regardless of what technology they use. And our footprint is expanding globally. We have clients in Canada, the United Kingdom, Australia, Singapore, and Malaysia. And as we continue to grow internationally, Allscripts, like you, is confronted by common problems that know no boundaries. As our population increases, so too will the number of elderly, who in the United States account for 80% of all healthcare costs. Even as the need for healthcare is rising, fewer people are choosing medicine as a career. The shortage is worse in developing nations. In case you're wondering, Norway is the best with 42 physicians for every 1,000 people. Many places in Africa have less than 1 physician per 1,000. Rising global wealth is spreading, and with it, the diseases of prosperity, fueled by obesity and inactivity, diabetes, heart disease, and hypertension. By 2030, it is expected that chronic diseases will outpace infectious diseases as the leading cause of mortality. And as we heard earlier, the rising cost of care. We're well aware of the cost curve, which has outstripped GDP in all OECD nations for nearly 50 years. To put the projection of rising costs from IHS Global Insight in context, the McKinsey Global Institute projects that global GDP during roughly the same period will double from 60 trillion to about 120 trillion US dollars. So if nothing else changes, we're looking at world healthcare costs growing from about 0.5% to nearly 12% of global economic output. That's an enormous burden for states who are facing many other priorities, a burden we may be unable to carry. In both developed and emerging markets, all of these global health challenges are compounded by the age-old problem of the unequal distribution of wealth. Life expectancy is a good proxy for the overall quality of healthcare in a nation, which roughly tracks GDP. Poor and rural areas of the world remain underserved by healthcare services, and as we heard commentary earlier, especially in rural areas here in India. But emerging nations have one key advantage. They are able to start fresh, leveraging advances in technology. When you think about healthcare, rather than building a network of new hospitals, emerging markets can move quickly to address the needs of their citizens with new technologies that leapfrog old brick-and-mortar approaches. An example from another industry, telecommunications, illustrates this ability. In India, decades of state-owned monopolies left the vast majority of Indians without a phone. In 1980, there were 2.5 million phones in India, for a population at that time of 700 million. Just 3% of India's 600,000 villages had phone service. All of that has changed with the arrival of a new innovation, the cell phone. Today, India has the second largest mobile phone market in the world, with a user base of over 930 million. It is poised to become the world's largest, with nearly 8 million new users added each month. And as the cost of cell phones has dropped, so too has the inequality of phone distribution that existed in the past. 17 years ago, when mobile phones first became available, they were only the province of the rich. Today, nearly everyone has one, even in rural areas. The example of India's cell phone usage shows how an innovative technology can leapfrog major gaps in infrastructure in the developing world. That's a fact that I believe bodes very well for our ability to solve some of the global challenges I mentioned earlier. For the very reason that its healthcare infrastructure is less developed, the developing world is perfectly positioned to take advantage of new breakthroughs in healthcare information technology. So let's take a look at some of the healthcare technologies that I believe have the ability to enable better health. Some already established in developed nations and just now taking root in developing nations, and some that are new to all areas of the world. First, telehealth. Telehealth is a term that has evolved in recent years to include not just telemedicine, but a wide variety of technologies that, when you think about it, really extend the reach of providers by equipping them with the technology that is needed to overcome the physical limitations of geography. Telehealth helps solve the problem of too few providers by enabling a small